All right, welcome back to the show. Checking in real quick on the government shutdown. People are getting a little antsy. Some fear mongering going on, especially with regard to air traffic controllers and some military personnel and other people concerned about their upcoming paycheck, whether they get paid or not. We can fund 60% of what we currently fund with our ongoing cash flows. We're on such massive deficits, another 40% has to be borrowed every week. So this exposes both the awful management of fiscal policy by members of Congress and the executive branch over many decades by both sides. And it should be a wake-up call to balance the budget. Of course, it will not be. So a lot of fear-mongering out there. Republicans seem to be holding firm, although President Trump did indicate he was willing to talk to Democrats again about healthcare costs, about healthcare subsidies for Obamacare. Republicans are going nowhere on the Democrats' demands for healthcare money for illegal immigrants, and that should be the case, of course. You can't have open borders and a welfare state. Just doesn't match. It will be easily overwhelmed. Of course, we're a great example, and all of Western Europe is a wonderful example. Anyway, the shutdown doesn't show any sign of stopping. Democrats are continuing to demand a full funding bill, an extension of enhanced Obamacare subsidies that are set to expire in 2025. What happened was during the Biden years, not surprisingly, more bad policy out of the Biden years, he gave the COVID credit, and it basically made the situation worse in a couple ways. They shifted a portion of the premium payment away from the enrollees, the users of the insurance plan, to the taxpayer, again under the headlines of COVID, and they brought more people into the subsidy structure by lifting the cap on the income levels to be eligible for Obamacare to 4 times the poverty line. And that's just way too high. People that are 4 times the poverty line can afford to pay their own health care. Obamacare subsidies, as we've seen them since 2020, have been highly inflationary. And then to expand the subsidy structure to more people just added fuel to that inflationary structure. But the demand for more Obamacare subsidies belies the fact that Obamacare, the Affordable Care Act, ACA, passed in 2010, is a massive failure in every way possible. President Obama promised you could keep your own doctor, costs would go down, access would improve, and quality would improve. And none of those things seems to have happened. You couldn't keep your own doctor, costs went way up, access went down, and quality went down. Moreover, it's created a splintered market, a rise of private healthcare for the wealthy, hospital systems moving from nonprofit to for-profit hospitals, massive amounts of private equity money pouring into the healthcare medical care sector, ballooning costs. The old premise of the idea was there were too many people uninsured when it comes to accessing medical care. At the time, they claimed there was around 30 million people. And so the idea was that these 30 million people were largely poor people, forgetting the fact that young people don't need health insurance for obvious reasons. And so the idea was to provide Obamacare, the ACA, to give healthcare to all. And that's been a failure as well. It was just replace one group of people with another group of people. The relatively poor that were uninsured are now insured under a horrible insurance plan. And middle American families have been destroyed. The people now that don't have healthcare are not the poor, but the middle class or the working poor. Remember now also that the Obamacare program, the Affordable Care Act, also included a huge number of mandates that dramatically increased the costs for doctors and hospitals. Democrats warn now that American healthcare costs are at risk of drastically rising if those enhanced subsidies are allowed to expire. That's just not true. The inflation in healthcare costs is a result of Obamacare. We have thousands and thousands of patients continuing to pay high prices for medical care, and the primary cause is the unaffordable mandates imposed via Obamacare and the continued subsidies. It's moral hazard, making use of that which you don't have to pay for. Now, you recall Obamacare did include a federal level tax penalty for Americans who did not insure themselves after passage. That was repealed during the first Trump administration. Some states have put that back in at a state level. But when insurers increase premiums, the cost is not paid by the enrollee, it's paid by the taxpayer. So Obamacare was bad to begin with. Biden has made it worse. So when you have all these people in the healthcare market, the medical care market, who don't care what the premiums are, of course they're going to use all the medical care they can, and that's highly inflationary. Some data shows that Obamacare premiums are up 80% since 2010. And so when it comes to healthcare, Americans are paying more but getting less, paying higher deductibles, having their claims denied, unable to see a doctor in a timely fashion, while insurers are profiting off of generous taxpayer subsidies. Not a good outcome. Since 2010, every Republican I've ever heard campaign for any office has campaigned on the idea of repealing Obamacare. And they had plenty of opportunities to. They talk the tough talk on the campaign trail. Then when they get in office, they get a little bit anxious about the idea. And it's under this heading, the idea that once a entitlement program is placed, it's political suicide to remove it. That within a short time period of a new entitlement program coming online, millions of people become instantly dependent on it. And then to take it away risks political votes, political clout, political power. And so Republicans have been just embarrassing for 15 years now, campaigning, repeal Obamacare, and then just collapsing in the face of pressure once they're in Washington, D.C. Anyway, a little check on the government shutdown on Obamacare. Obamacare has been a failure, and the request by Democrats for this money is not going to help anybody and should be denied by the Trump administration. Although, let's remind ourselves, the only way to solve this government shutdown is going to be compromise on both sides. And maybe one of the compromises is funding this subsidy, the Biden subsidy during the COVID program for one more year. Again, set to expire this year, give them one more year. And that's what they offered, but Hakeem Jeffries has already denied that offer. This shutdown is on the Democrats completely. Don't let anyone fool you. All right, that's all I have for you right now. Always try to buy American.